Hi everyone. It's a pleasure for me to be here, and thank you very much for the invitation. I am Agatha, PI of the Brazilian Obstetric Observatory, the OBR, and I will present now a timeline of how this work has contributed to understanding the situation of the maternal population during the current pandemic, and what we have been doing to disseminate the obtained information in Brazil. Next slide, please. The OBR COVID-19 started at the end of February of this year in order to assess the maternal situation during the pandemic by analyzing public data sets on hospitalizations of pregnant and postpartum women. Our first idea was to follow the usual path of the academic area, to publish the findings in scientific journals and then disseminate the published knowledge later. However, we observed that the pandemic scenario to the maternal population was getting worse, and at that moment, this population was not considered as a group of risk. Next slide, please. To illustrate that, we observed an 87% increase in the number of deaths only the first 4 months of 2021 when compared to entire year 2020, and a 116% increase in lethality in hospitalization cases. The pandemic in Brazil was getting worse for all the population, it's true, but for the maternal one, it was much worse. Next one, please. And so, by considering the seriousness of these numbers, we decided to disclose this data even before publishing them in scientific journals. The way we decided to present these results was by creating and providing an interactive dashboard to make data accessible, where users can filter and select desirable cases and choose the variables to make their own tables and graphs. With this dashboard, we gave visibility to already exist. They are public data set, but in an accessible way. Next slide, please. And at that same moment in April, you gave our first interview to a newspaper with great national repercussion to present and to talk about our worrying findings. Next one, please. And after this first, we gave many other interviews to national and international media, and this task of communication, the findings, was neither easy nor simple, but it was really necessary at that moment. Next one, please. And all these repercussions contributed to society's understanding of the serious scenario of the pandemic for the maternal population, and also to support decision makers in public policies. Only 2 days after the first interview, the health minister presented initiatives to support maternal health. In May, we had the law that guarantees home office for pregnant workers, and also in May, the vaccination for the maternal population started. The OBR data supported the discussion to include pregnant and postpartum women in the priority group for vaccination. Next one, please. And besides journalists, the dashboard has other users. I would like to highlight here the human rights organizations and the state and municipal stakeholders that used the data obtained from the dashboard to understand the situation in their city and state. And it's really very important to say here that some stakeholders did not have tools to visualize and access their own data until then. Next one, please. And once started the vaccination for pregnant and postpartum women in June, we created another interactive dashboard with similar characteristics from the previous one, but now to monitor vaccination data for maternal population. All these dashboards were built in using open source software, and all code is also available on GitHub. Next one, please. So at the beginning of last month, we analyzed the vaccination profile of hospitalized pregnant and postpartum women, and you got important results. 80.4% did not take any dose of the vaccine, and only 4.3% were completely immunized. And besides that, not vaccinated hospitalized pregnant women are 5 times more likely to die from the disease when compared to those that are completely immunized. And these results also had great repercussion in newspapers and TV news, and reinforced the importance of vaccination for the maternal population. Next one, please. And despite first disclosing the results, we didn't forget the scientific production. We have some papers that have been published, others are under publication process, under review, and also other papers in development. Next one, please. And so this slide summarizes how our project has contributed to facing the pandemic for the maternal population. By not focus only on scientific production, we disclosed worrying findings in the supporting decisions makers in public policies that reflected important actions for better conditions for the maternal population. For example, by considering them as a priority group for vaccination. Next one. But unfortunately, we still have a lot of work ahead. We estimate that only 20% of pregnant and postpartum women are completely immunized. And unfortunately, we still have misinformation circulating once pregnant women are the favorite target by anti-vaccine groups. Next one, please. And a question that you are asked we will do to disseminate our studies findings. We have the just released OOBR Instagram and Twitter, and a weekly newsletter to update the news from our project findings and disseminations. And I would like to point out that that's not our role to campaign for vaccination directly. There are other institutions that do that. Our intention here is to provide access to data for knowledge dissemination and to support decisions. Next one, please. And the question that arises here is, how many opportunities for social relevance would you have missed if you have only focused on scientific productions? And how many pregnant humans' lives have been saved because of our decision in the past to disclose these troubling findings that pressed the public policy decisions for these populations? And so, next slide, please. This is the great OOBR multidisciplinary group that I'm very proud to be part of. And now, next one, please. Finishing my presentation, I would like to say that we are open to research collaborations with our expertise in data science and dashboard constructions. So if you have any questions, please contact me. Thank you very much for your attention.